So we decided to do 3 more. Once we got a sense of what was happening with COVID, and it's a slow opening, and there's a lot of apprehension. There's a lot of miscommunication out there. So we thought we should have an expert come in and talk to us about what a return to work would look like. Because I was speaking with a friend, and we were talking about going out and buying groceries and how anxiety producing it was. And she said something to me that kind of struck. She said, you know, Costco really has it nailed. So I don't have as much anxiety when I go there. I actually feel really okay being there because they've done everything and I trust them that they've taken care of stuff. And a light bulb kind of went off, and I thought, you know, for our workplaces, if we could create space that our staff feel good in, feel that they're safe and that things have been taken care of, then that takes a whole load of anxiety off them. And then hopefully when they're doing their work, they feel comfortable and they can just concentrate on that and produce their best work and feel good about it. So we thought about Mary Beth, who has done a lot of work in this area, and she's in the healthcare profession as well. So she's thinking about COVID from that perspective, but she also manages a large team of people and trying to create a safe workplace for them. So Mary Beth, if you, thank you for joining us, first of all. And so if you can share with us what you know, and for us as leaders and company owners, to create a space where our staff can feel comfortable and good about coming into work, what are the things that we need to think about and how can we support them best doing that?
Okay, first of all, a huge thank you to you for reaching out to me and inviting me to do this, because we have been living it. So right now, my full-time position is managing a mental health floor in an academic health sciences center. So we have not been working from home. We've been at work the whole time, as you all know. So what I thought I would do is maybe talk to you a little bit about physical space, psychological space, and consideration for your staff's mental health. Does that work for everybody with just nods? Yes, we're okay with that? Okay. So with physical space, and a lot of this, I'm sure that you know, but I think it's worth mentioning. When your offices reopen and people are returning to work, they're going to have to work a little different because the social distancing isn't going away. They're just going to open our workplaces. So there are things that we need to think about in the workplace, like how do you create 6 feet between people? If they're in separated workstations, that's great, as long as there are walls and barricades. But how do they social distance in the lunchroom if you have a small lunchroom with a smaller table? So you'll need to think about things that will allow for social distancing. It could be as simple as tape on the floor, right? This is like Les Nessman offices back from WKRP. So, you know, tape on the floor, indicating where their space is, creating in your lunchrooms or social gathering areas, coffee stations, setting up rules and expectations that will prevent more than one person. You know, you'll make your Costco lineup at the coffee maker and make sure that everybody realizes that we're not back to normal. This is probably our new normal. If your staff use lunchrooms, maybe it's around scheduling lunches so that no more than, you know, depending on how big your lunchroom is, you know, scheduling so that only X number of people can be in the lunchroom at a time. Do you have Purell dispensers on your walls at work? Nods. Yes. Andreas has them. Yes. Okay, good. So Purell dispensers at every hallway or doorway opening, outside every cubicle, because COVID is coming back. And it's going to come back for wave 2, and wave 2 will hopefully not be as bad as wave 1, but it will come back. And what prevents transmission is hand washing, not touching your face, and staying 6 feet away. So those we know that does that. I would suggest that you have masks, either the cone masks like this that that you can get medical cone masks or just the regular procedure masks. I think you should have those in your workplace, because people will come to work sick. They will come to work sick, or they'll get sick at work. And you want to have the ability to minimize risk to the rest of your staff as much as possible. There are, you may want to consider your cleaning practices. I know this sounds crazy, but did you know that most of the disinfectants and the cleaning products that are out there, the product has to stay wet on surfaces for anywhere from 30 seconds to 5 minutes? That it's not just a wipe, it actually has to stay wet on the surface to kill viruses and bacteria. So how are you cleaning, your cleaning staff or whoever does that? Are they spraying surfaces and leaving them? These are all little things that truly need to be formalized in policy or standard work practices. Those were the big ones for me, is really jumping on the Purell and talking about creating less Nessman offices so that people know where the space is and where they can and can't go, and how do you create that 6 feet, because those are the things that are going to make the difference. So psychological space. I think this is going to be the biggest challenge, because for folks who have been working from home, you pretty well have been working alone together. And what's going to happen when you put all those people back in the same workspace is some people are going to have to learn how to work in an open office concept. They're going to have to learn how to stop drop-ins. So for example, those of us who are extroverts and we love to be extroverted thinkers, one of the things that we would want to do is, I want to go to Roger's office and I want to brainstorm with him because I want to figure this out. Well, that is not something that Zoom or working from home has allowed. And so people who have gotten used to working alone are going to have to relearn what the work office culture, environment, and what that is like. It's going to cause, some people are going to have huge stress over it, huge stress about reintegrating into the workplace where there are lots of people. And some people are going to just run with it. But for the most part, the getting used to the office environment again, where there are lots of people, there are lots of things going on, lots of distractions that didn't necessarily exist at home when I could go into my home office and close the door. People will need consideration to create psychological space when they return to formal offices. And the third thing that I really wanted to talk about is around mental health. We in mental health are expecting the next phase of COVID-1, if you will. We're actually ramping up for a mental health crisis. We expect that there is going to be, oh, okay, sure, I will do that, Rachel. We're expecting that when quarantine is over and self-isolation is over, there are going to be long-term complications and long-term psychological effects from this. The effect that we've seen so far, we know it exists. It just hasn't presented to the hospital yet because we're still pretty well shut down for anything that is not urgent. But this is going to present as depression. It's going to present as anxiety. It's going to, the manifestations that I think that we're going to see and that you'll see is an inability to cope, an inability to follow direction, confusion, and agitation. So what I would say to you as leaders in your organization is watch for these signs of agitation, anxiety, the nonverbal cues, deliberate distancing from other people. Those are all going to be manifestations of mental illness and what goes with that. I hope that you all have an AIP program or some sort of an employee assistance program where staff can call a number and get help if they need it, or perhaps the provinces that you're in have a call-in line. I think there's a federal line as well, like some sort of a crisis line. But being open about those conversations and creating safe space in your organizations to have those conversations is huge. People who are going to be coming to work have been working from home, so their family's expectations about their availability is going to be different, right? Now they're at work, and you can't be running to talk to mom or dad or just calling out of the blue. So they're going to be pulled back into their family home because that's what their family has been used to, is having access to them 24/7 for the last 6 weeks. So I think consideration for that and recognizing it's going to be a transition there. Watching for signs of mental illness, signs of anxiety, depression, stress, agitation, distracted thinking, confusion, needing more direction than is necessary, not able to put a concrete or concise plan together. Those are all things that, if these are new, they're probably related to something they're dealing with. And my very last point that I wanted to touch on is, I don't know if you're aware, but there have been 9 women killed by their partner since COVID started across Canada. Our men and women who have been at home in abusive relationships, be those psychological or physical, they've been locked up with their abuser for the last 6 weeks. So those abusive relationships, that could just be somebody who's a really strong personality who tells the other person what to do. And, but somebody who is in a relationship, just so you know, the stats tell us that. So if that person happens to be on staff with you, they could come back to work broken. So what I would say to you is just be aware that as things start to lighten up, both in your work life and your personal lives, that people who are in secret abusive relationships, they have been locked up with that person with an inability to call or get out for the last 6 or 8 weeks. And if they're in your office, they will come back to you broken. They'll need a lot of help. So those were my big highlights, Laura. Excuse me, that's not COVID. Those are the big things that I really wanted to talk about, was just, the hand washing and the Purell stations and letting people create space. Rachel had a question about how do you get, talk about getting consent, right? So, yeah, that's a great idea. So if you're looking to, if you want to enter somebody's office space or cubicle space or whatever, I think the whole idea of asking permission, can I come in? Or because all of us have different levels of tolerance for the 6-foot rule and whether you have to have a mask. And there's huge anxiety around COVID. Some people are completely off the deep end with anxiety related to COVID. And it's interesting, the example that you gave about, Laura, that you gave about Costco, because those carts get wiped down and that doesn't stay wet for 30 seconds to 5 minutes. But don't tell your friend that. So it's one of those things where it creates a false sense of security, but it's better than nothing. But I think asking the person to try to figure out what their degree of tolerance is, they may not want you anywhere near them. They may want 10 feet. And I just think asking permission and is absolutely getting consent to enter their space is very, very reasonable. And I think as leaders in your organizations, if you set that up as policy, that's part of the performance expectation, right? That they're going to ask permission, that they're going to use Purell when they leave their cubicle area, that they're going to, stay 6 feet away at the coffee machine. Like, you're going to have to create a new normal and a new standard.
Great, thank you, Mary Beth. I heard from somebody that who's a manager, and he said to me, I'm embarrassed to wear a mask. And so I said, I understand that too. I kind of feel weird too, especially, if I'm driving with people and I'm wearing a mask. And I said, but you have to model that. So, draw a funny face on your mask or do something, but that has to be modeled as leaders so that people will feel comfortable doing it. Because as Mary Beth said, there's people who are uber anxious and worried, but there's also on the other end of the spectrum, people who are like, oh, this is just it's no big deal. No one's going to get sick. I don't know anyone who's gotten sick. And so you're going to have both ends of the spectrum. So, I think we want to err on the side of being extra cautious, but modeling that. And all of you have told me about things that you've done that have been fun in your meetings. So again, make this fun, have little sort of inspirational sayings on the tape that's going around the office. And, especially going into cubicles too, make sure that, people don't just automatically walk in and that there's something there. So thank you for all the helpful tips. That was excellent. And, as you said, we have heard some of these things, but having it concise in the, psychological, in the health side is great. So appreciate your time. Going back to something that I think we had discussed previously is trying to find out from each individual what they need, because everyone's home experience is different. So there's some people who are really looking forward to coming into the office. Some people don't. So having that engagement with them one-on-one to get a sense of where everyone is at. The other thing I wanted to bring up is, we talk about our staff a lot in these sessions, but we have to, remember that we have those feelings too. So maybe you have felt some anxiety. Maybe you have felt some, wishing things were different or back to normal. So what are you doing to take care of those feelings? Because we certainly can't expect our staff to help us with those. So where are you going to, what's your outlet? But I don't mean to take it into the unfun territory, but I did want to share a couple of experiences that I've had with people recently, which goes back to some of the things that Mary Beth had talked about. With a few people in particular as I noticed, there's an increase in people misinterpreting what others are saying and taking it really harshly. I was on a meeting, a call, and someone said, oh, you've been working out on your own, and they used the term, we want to bring you back to the nest. And the other person got very upset and said, you're making it sound like I'm a bad person, that that I'm not working with everybody. And that wasn't at all the intent. And I'm just finding a lot of those things happening more and more. So I was reflecting on that and how people have handled it, because you might find that sort of skewing of communication and going into the glasses that we all look at the world with and twisting around. And some of the things is, stay curious. That's what we have taught about, for coaching, is asking those good questions, saying, this is what I heard, but is that what you meant? And letting people explain that. And then also ask them for permission to share your side of the story. I think, previous to this, we could say, well, this, that was my cat muting me. The realities of working at home. But saying, is now a good time for you to hear how I experienced that? So asking for that permission is a helpful thing, I noticed. And asking people what they need. And sometimes it's been time to think about it, time to process feelings. I had one woman say, well, I live on my own, so I have to process by talking it through with people, and that's created some problems. They don't want me to process with them. So she had called to process with me instead. So just think about some of those things that might be a little bit different in how we interact with others, and staying more open and curious about people's reactions to things. In the last couple of minutes we have, I wanted to just talk about our next session, because Laura Jones, who's with us today, if you want to give a wave, Laura, is going to be our speaker. And I met Laura through a grief recovery workshop that she does. And what I learned there was super interesting, and I think it's relevant to all of us. And one of the things that I had learned is that grief is a normal and natural reaction to loss, different types of loss, but it's not a mental health condition that needs to be treated. So if people are suffering depression or anxiety in the workplace, you know, perhaps that's something that needs to be treated, but they might be going through a loss. And one of the other things that I thought was really important is, you know, because I'm an optimistic person and I look for the silver linings in things, what I say to others when they might be going through something could actually be could be damaging. Like, oh, isn't it a great day today? It's so glad we're working back in the office. I'm really loving this. But leaving space that maybe that's not what other people's experience is, instead of coming forward with that all the time, which could shut them down and keep communication not so good. So to think about the things that we're saying, Laura's going to talk to us about that as well. And I think one of the biggest learnings I had, you know, I always thought grief was around people dying, but grief is around a lot of other losses, like being an empty nester, any lifestyle changes. And of course, we've all gone through a lot of those. Just looking at this, it's a big list. Canceled vacation plans. You know, I was going to, because things are opening up, I was going to go and visit my father next week for the long weekend, but I'm in the high risk category. And so my family said, you can't go. And so I've suffered a loss around that, and it doesn't feel that good. I was really looking forward to getting out of the province. And so lots of those things that can happen in our lives. So Laura is going to talk to us about that and how we can support ourselves, but also how we can support our staff. So we are at the top of the hour, and just wanted to ask for any last comments or thoughts before we break. Thank you all for being here. I did have a last thought. Oh, yes, the last thought is, if you could please submit anything that's learnings that came out of your session. Lisa will capture those on the visual chart that she's doing as well, and then we'll send that out. We'll send that as a summary as well. And then if you know anyone who is thinking about the topic, I'm sure there's lots of people, please feel free to pass that along as you wish. So I hope to see you next week. We are meeting on Wednesday